Amendment 3 made some significant changes, not just to recreational use in Missouri, but also to the use of medical marijuana in Missouri. So I think most employers will be well served to go review their drug and alcohol-free workplace policies, look at those things, and ensure that you're in compliance with the protections that were added in for medical users as well. Under the medical side of things, one of the major things that changed is they added in explicit protections for medical users, which weren't present in the law prior to this recent Amendment 3 passing. You're not allowed to discriminate against medical users in the hiring, firing, or any terms of employment unless you meet certain criteria. One of the benefits we got from Amendment 3 was some of the gray areas around federal contractors, people that had licenses that required federal drug-free workplace programs. Those things are addressed in the new amendment, which weren't present in the prior medical amendment that passed. With recreational users, I think the most noteworthy thing for employers is going to be to understand that the number of people that are using marijuana in our state is going to increase, and probably significantly so. Medical users had to go through an entire process of being certified through a doctor. They had to renew those annually. You could lose your certification if you abused it. Recreational users, however, anybody that's 21 or over can walk in to a licensed dispensary in the state and purchase cannabis legally now. So the distinctions there is going to be they didn't go in and speak with a doctor. They didn't get a lot of the information around this that a medical user might have gotten. So you should be mindful of that. And when you're reviewing your drug and alcohol-free workplace policies, make sure that you have strong language in there around what's prohibited. What should be prohibited is being under the influence of any intoxicating substance while they're at work or using work equipment, things of that nature. That's really what you're going to want to do. And one of the most common questions that I get is, how do I know if somebody's impaired? Unfortunately, unlike alcohol, which has blood alcohol testing, which tracks very closely subjective impairment that somebody's seeing, you can have them blow and know, hey, based on what you just blew, you're impaired at this level. Marijuana doesn't have anything like that right now. So the best we can do at this point is have somebody that observes a particular behavior in the workplace, and then a test that goes with that, so that you can not only place that there was a substance in their system, but that they were under the influence and impaired to some degree while they were at work for you. That's going to be the strongest thing you can do right now. And that all starts with a written drug and alcohol policy. So have a written drug and alcohol policy. Make sure that you're still doing testing. That is the cornerstone of any program. And then all that contributes to a culture. And the culture is really your strongest weapon for workplace safety. That is going to let people know that we don't tolerate intoxication of any kind at our workplace, that we have policies and practices in place to support that. And that sends a message to your workforce to let them know that it's not welcome here.